I wish my wallet was thick enough to cause me some back problems. If you have a thick wallet and you're sitting on it all the time, your pelvis is going to start tilting. Then your spine is actually going to compensate and tilt the other direction, which then can actually cause chronic low back pain. Get the wallet out of there, maybe put it in your front pocket or debulk it. Very funny. More money, more problem. Only guys will understand 80 degrees, your balls. At 30 degrees, you're like, the scrotum definitely goes, or it gets like hot, sweaty, totally uncomfortable. When the temperature is really crazy hot, the testicles want to get further away from your body. When it's super, super cold out, get closer to your body so they can stay warm. I don't think I've ever felt that my testicles were the size of 2 large melons. The last drop is mine. Oh, that's so gross. There's typically always a little dribble that's left.
Dribble, dribble.
You have a longer urethra, and anywhere on the tract there could be a little bit of urine that doesn't totally get out when you're done urinating. No matter how many times you shake a little bit, there's always a little bit of urine. If you're shaking it too much, stop playing with it. It hits my elbow on a desk, my entire nervous system all... So here, funny bone, right? So you're actually hitting your ulnar nerve. So you're just irritating it, sending that weird feeling, and you gotta shake it out. You're not actually causing permanent damage, so it should go away. If you're continuing to have symptoms, you need to get checked out by a neurologist. When I realized I put the wrong socks on this morning and now my feet are wet. I'm assuming you put on like dirty socks. The reason why it's an issue is because if your feet stay wet, something called trench foot, where people would get wounds, they would heal, infections would just fester. You want to prevent abrasions, blisters, opening sores, and then you also want to be able to air those out. Society and men with clear mental health issues deal with it. In general, we have a society where we have medical problems, we have mental health problems, we have surgical problems. A lot of times men will just ignore it or push it aside, but you don't have to be like running. If you're having an issue, you have to deal with the issue. That way you can move past and be the best human that you can be. I see a fountain with 2 choices. Body, organ, tissue, cell. So they're all connected. I love it. Sometimes alcoholism is something that affects multi-generations. So if somebody in your family, unfortunately, is an alcoholic, it could potentially either scare somebody that they might actually get it too from a genetic standpoint, or more apt to it due to a behavioral issue. And if you have an addictive personality, it's something you need to confront head on. Find activities or habits that are healthy that you can be addicted to, so to speak, versus anything that's detrimental or bad for your health. Getting medical advice on Facebook forums are like, random poster, oh, I'm not a doctor. We get lots of comments of people just saying, no, it's this, or no, it's that. And it's like, yeah, I can Google something too and just come up with different ideas. But if you don't know somebody's history, you can't just be like, oh, he has this, without actually examining the patient, knowing what the patient's medical history is. So bringing up concerns, bringing up your ideas of what you searched on the internet or what somebody had told you is totally fine. It's our job to then discuss with you why it would not or why it would be, whatever your diagnosis that you come up with. Patient education on fecal impaction. Sure, this is your colon, and here is the feces growing inside your belly. Oh my gosh. A lot of times I'll show somebody on a CAT scan how much poop they have, and I'll actually say you're like FOS, full of stool. And if it's impacted, typically the doctor needs to go in and do a manual disimpaction. You double glove up, you stick your fingers in there, and you start helping pull out the poop, and it's excruciating. Please have healthy bowels, good food, walk around, drink lots of fluids, and listen to your poop signal and go to the bathroom when your body's telling you to go to the bathroom. It looks like you're pregnant. Patient, what the F? I'm a male. Doctor, I said it looks like you're pregnant. You never want to call somebody out. You never want to make anybody feel uncomfortable. But you do have the discussion as a physician. If it's just related to adipose tissue, which is too much fat, then you say, hey, what's going on? Or do you have a plan? Where you at in your diet and your habits? That sort of thing. It's always good to just have a good conversation versus telling somebody that they're overweight and whatnot. When doctors suggest husband get a vasectomy, I love it. A vasectomy is a procedure that the guy undergoes to stop the sperm from getting in your semen. That way it's not ejaculated out. They are actually even reversible versus a tubal ligation, tying your tubes, that a woman would have to do, which then is typically not reversible and then increases the risk for the woman to have other complications. They told me I could become anything I wanted, so I became a roadmap. Holy vascularity. That is a lot of blood vessels. That is a lot of veins. This guy has probably super low body fat, but is also jacked. So he's straining a lot, requiring a lot of oxygen to his tissue because of the amount of lifting that he's doing, increasing demand on the system. And he probably had some neovascularization where he's actually making new blood vessels because of the demand. That is intense. Well, you see, doc, the problem is obesity runs in my family. Doctor, no, the problem is no one runs in your family. Running is good from a cardiovascular standpoint. It's good for your heart. But majority of obesity is diet. They even say abs are made in the kitchen. Sometimes, yes, there are medical reasons why somebody might be obese. But majority of the time, it has to do with our diets, what we're eating, our lifestyle, what we're drinking. If you're suffering from obesity, having issues, please discuss it with a healthcare provider. See a nutritionist. Get some help. Find somebody on the internet. Woman, doctor, my husband wants intense sex all day. What can I give him? Doctor, my number. Totally inappropriate. We all have different levels of sex drive. Asking a doctor's advice about anything related to sexual health is important, in having that open conversation and figuring out what you could do. In this situation, it would actually probably be better to have like a sex counselor, marriage counselor. Patient acting up, they must want to take a ride in the van. The Ativan, nice. Ativan, it is a benzodiazepine. We give it to people who potentially are acting up, who are having panic attacks. Sometimes we'll actually use it for induction in procedures that you're having. It potentially can cause amnesia as well. Think about that when you're actually taking these medications. Doctor said my knee is gonna be just fine. That's a knee replacement. You can see hardware on the distal femur and then the proximal tibia. And obviously you see the genitalia just like super there. It's actually typically not that prominent. Yes, it will show up a little bit on an x-ray. Urinalysis rep be like, nice watch. Oh my gosh. Okay, I can remember I was in college, I played Division I football, and we would do random drug tests. I woke up one morning, I had to test at like 8 o'clock. But immediately when you wake up, don't you just have to pee? So I went to the bathroom right away, and then I was like, oh no. I go to the testing site. Literally, they go in the room and they watch you. But I didn't have to urinate. So I drank like cups and cups and cups of water, and then I just, after about a half hour, finally went to the bathroom. And then I just couldn't stop going to the bathroom all day long. But it's very interesting. Sometimes people have stage fright. You have to like coach yourself, just go to the bathroom. You always get those like onlookers, or you get the people that are urinating next to you or talking to you. It's just an awkward situation. And obviously, nice watch means they're looking at your junk. Stop looking at each other's junk. We all have it. What do I tell my mom? Oh, that looks very impressive, but it literally is just dead skin coming off your hand. What potentially caused that? Some blister of some sort, caused either from a burn, a sunburn, a burn from hot water, or could have been from like prolonged like rubbing. Deep scrub and water will get it. Different bacteria and funguses can grow in these areas. You really need to deep clean them, but also keep them dry. I find a lot of issues end up being with people keep the area kind of moist, and it is a breeding ground for fungus. That's why kids get diaper rash when they're kids, because of wet diapers. How to pee in the morning. My eyes went right to Superman. The tube, that's awful. The Superman, the handstand, the frog, the lunge. Oh my god. Oh my gosh, the blow dryer. This is all in relation to go to the bathroom with an erection. I have to say I might have tried one or two of these before in an attempt to make sure I don't, miss the toilet. The lunge seems the most normal, maybe the frog. Superman, definitely don't have a cape just flying around, but just make sure that if you do miss or spill, that you clean it up. Puberty. Me hoping to get taller and get a deeper voice. Hair. As we go through puberty, different things happen to our bodies. Sometimes people grow fast, some people get a deeper voice, sometimes you get the discomfort in your nipples, or you get facial hair, or you get hair where you don't want it to grow. You can get hair anywhere. Our bodies are actually covered in hair if you actually look very closely. Earth on December 1st. I think the earth is covered in snow here in Southern California. Probably unlikely to get any snow, but where I'm from in New York, definitely hope that they get a white winter snowy wonderland. Hot shower, cold shower. When you have a hot shower, you vasodilate, everything kind of relaxes. Down in the groin, the tissue relaxes, even the scrotum elongates, but in cold water, everything shrinks up. You're trying to pull everything back into the core. For certain types of like skin, your face, your hair, actually using colder water is better than hot water because it doesn't cause as much issues related to the skin. Me, heal my disease. Brain, no. Me, takes pill with no effect. Brain, you son of a bitch. I'm in. Sometimes the placebo effect is actually effective for individuals. But at the end of the day, if you need to be healed for whatever reason, make sure you talk to your healthcare provider. Oh, you're leaning over. Let me help by pulling your stomach hair when you stand up. Oh my gosh. Males are more likely to have belly hair just because of the pattern and the hormones relating to a male body. No shame in trimming it up. After sitting in a gaming chair, make sure that you get up, move around, stretch those legs if you're sitting in a gaming chair or you're sitting down for too long in general. Okay, sir, I need to take your ring off for these pictures. I hope they're not his fingers. When you see somebody who's got very swollen fingers like that, you think, are they obese? Are they very overweight? Or are they retaining fluid? And why are they retaining fluid? The other component now is you have this ring on the finger. That ring could cause ischemia and kill the finger if it swells up too much. Sat in a chair, didn't leave a sweat stain. Super excited. There are different types of chairs out there. The fabric ones can leave stains. You ever sit on a chair that's fabric that has like a circle on it or stain on it? That's disgusting. Why don't you digest some bitches? We got large intestines, small intestines, and we got some Air Jordans. But running around, moving around helps get constipation out of your body. Put those Air Jordans on. Smoking gives you cancer. Also, doctor, here, smoke this weed and you'll be fine. People with lung cancer. Okay. Does smoking cannabis potentially increase your risk of cancer? Yes, there is a potential because of the combustion. But people who smoke cigarettes are smoking a pack a day. You're not smoking the equivalent of that in cannabis, and typically you're not having all the other additives. Smoking anything is not good for you and has the potential to increase your risk of getting cancer in the future. 9 in 1. Trust me, this is science. Oh my gosh. Look at your ingredients list and look those ingredients up on the internet. They all have whatever they potentially could cause or not cause. Not sure if I should buy health insurance or go bankrupt when I get sick. I mean, this is an issue that everybody can relate to. Luckily, at most hospitals in the United States, if you don't end up having insurance, they actually end up figuring out a way from a plan standpoint to figure out what would be potentially something that you could pay for and affordable versus bankrupting somebody. Anybody who comes to the emergency department gets seen no matter what, insurance, not insurance. Doctor, do you get at least 8 hours of sleep each night? Me with a Bang energy drink. Sometimes yes, sometimes no. Depends if I'm flipping schedules. So I work overnight sometimes and then I need to go back onto the day schedule. So I'll sleep just 4 or 5 hours, be up for the day, and then go back to bed later that night. But you definitely got to be careful with energy drinks. I actually try to use alternatives, water, apples, just eating normal food. You know, sometimes we do need caffeine. I try to stay away from the energy drinks that have a significant amount of caffeine. If I try to have one, it's got to be less than 200 milligrams. How many hours of sleep a night do you guys get? Let me know in the comments. Guys have only 4 ways out of depression: military, getting jacked, drugs, and Bitcoin. So the first one with the guy with the helmet and the weapon, I don't like it. It looks really creepy. If you're feeling depressed, talk to somebody about it. Then you need to make sure that you're eating well. You have to make sure that you're sleeping well, drinking plenty of fluid, make sure that you're getting exercise, make sure you're getting outside and getting some sun. Obviously, you don't need to bake in the sun and hurt your skin, but getting out in the sun, seeing the sun, it helps your circadian rhythm and gets things up and running when you wake up. When you accidentally wish sweet dreams to your diabetic friend. Sweet dreams is supposed to be nice, but yes, a diabetic should not have sweet dreams. We don't want their blood sugars going up. Sometimes what ends up happening with diabetics, they may be controlling their blood sugars too well, And so they might actually go hypoglycemic, which means decreased blood sugar in the middle of the night, which causes their body to release all of their stress hormones. And you get epinephrine, norepinephrine going crazy, which then increases the sugar. So in the morning, they might actually be hyperglycemic. You have to be careful, watch your blood sugars, and know what medications you're on as a diabetic. This is huge. You go to feel your testicles, they're not there. I'd be dilated the other direction if I couldn't feel them. The other component is the pupillary constriction. Typically, we see this in somebody who is having opiate overdose versus the opposite. If you are very up and excited, you'll actually get dilation. Milk makes your bones stronger. 8-year-old me thinking how my skeleton will look like if I drank milk. So this meme is trying to depict that these muscles are supposedly in large bones. No, they are not. Does milk actually make your bones stronger as we get older? There's more research out there that there's some interplay with calcium to get those kind of muscles. One, it's partly genetic. The other is activity, diet, lifestyle, many different things. And it doesn't happen overnight. You actually have to work for it to get those muscles. You have to lift a lot of weights, and then being able to see them, you have to stay lean and keep your body fat low. You ever sit for so long that your butt feels like this? You're sitting on what's called your ischial tuberosities. Yes, if you're sitting on a surface for a long period of time, it can be quite discomforting and feel like your bones are coming out of your body. The pain you might be feeling is the maybe beginning of some breakdown of tissue. So just adjust and move off of that tissue to give it a break. Quick, before the next meme, hit that subscribe button. Are girls called chicks because they produce eggs or because they love? What kind of meme is that? This is kind of offensive in the sense of we call them a name because they just reproduce. No, they're a human being that has the ability to be able to reproduce. They don't have to. Puberty approaches. Thymus. Goodbye. Your thymus is a gland that sits kind of up here, and it's big when we're young, and it gets smaller and smaller as we age. It slowly disappears over time. And the thymus is very important in developing our immune system and white blood cells. Girls, if boys don't use toilet paper to wipe off their pee, what do? Boys. It's one of those like timers for keeping time. I used that when I was playing piano when I was a kid. There's an old joke, if you shake it more than twice, you're playing with it kind of thing. But basically, you're trying to shake out the extra pee that could be at the tip. But the problem is individuals that have a penis typically make a little bit more mess. So just be wary, be aware of that. Not with that rhythm. Just live. So it's an EKG strip, and it is quite an abnormal rhythm on there. I've never seen a tattoo like that, but I've seen people with abnormal rhythms like that typically turn into something disastrous. This technique has saved us a lot of embarrassment. Look up the statistics. An erection happens quite often on a daily basis, and then you start daydreaming, especially going through puberty, especially sitting in class all day, and then all of a sudden the bell rings and you got to get up and you're like, uh-oh, so you got to tuck it. Is it true most men pee on the doo-doo stains in the toilet to knock them off? Who the F out here telling secrets? That's funny. I do it too. At least you're aiming in the right place, and why not use your urine to help clean the toilet bowl?
Friday, you clean the toilet.
Most of the time, guys get blamed anyway for making it dirty. When she finally moves her big ass head off your arm. Oh my God. It doesn't really even have to be that big. It can just be in a funky position, and you're causing some decreased blood flow. You're also irritating the nerve, and you're getting numbness, tingling to that arm. It falls asleep. It's painful. Men turn 30, their nose hairs coming out. Vengeance. I've seen many videos where people are sticking this weird wax up the nose and in the ears. I probably wouldn't do that. Increased risk of infection, pain, bleeding. The nose hairs have multiple purposes, protecting the inside of your nose, even your ear hair. Also, it acts almost like a filtration device. So don't go ripping those bad boys out too much. Maybe trim them so they're not unsightly. Men 50 and older, doctors. Unfortunately, it's probably not 50 and older. It's probably less than that now. The good old prostate check. So you're checking the prostate, make sure it's not any abnormal lumps in there, making sure it's not enlarged. And then if it is, it needs to be monitored and followed, checking for prostate cancer. In the morning, whole day. I'm assuming we're talking about the morning wood or the male erection in the morning. Morning erections are quite normal. Even nocturnal overnight erections are quite normal. You probably still get erections during the day. It just has to do with your focus and what's going on during the day. My heart, writing a cold email, hitting send, see a response in your inbox. It's actually a funny depiction of someone's anxiety and nervousness, aka palpitations that potentially could occur. People come to the emergency department all the time for rapid heartbeats, palpitations, weird arrhythmias, and they can be caused by many different things. And you'll get a full workup relating to your heart that we can do in the emergency department. That does need to be followed up by a cardiologist because some of the exams we cannot get done in the emergency department in that moment. It doesn't just happen to boys, it happens to everybody. Hand sanitizer, 1 drop kills 99.9% of germs. Me puts 2 drops. Germs is the kid. I don't fully understand this one. Maybe you can help me out in the comments, but I can tell you that kids are very germy in the sense of they just harbor lots of infections, viruses, and they're not clean. They snot everywhere. It is a normal part of life. It's how we protect our bodies, by seeing the germs and having a defense against it. When it's hot and your scrotum just has to endure it. What type of animal is that? It definitely looks like a scrotum. When it's hot outside, the testicles want to be away from your body because it's trying to cool itself. So the scrotum thins out and elongates. And this kind of looks like that. People get sweaty down there, sweaty groins, sweaty scrotums. And there's different techniques to try to keep it dry, baby powder being one. Using the appropriate type of cloth and clothing down there. I did a whole video on this. Me, when the doctor gives me some pills for my depression. Are you sure this will work? Haha, I have no idea. There's a ton of different medications out there, and some work for some people, some don't, and they say just try this or try that. And it's probably related to your own chemistry in your body and how it reacts. I accidentally sneezed. I mean, I get that.
Wait, what?
I understand, I'm a doctor.
I would argue that every female watching this has been there.
That's a lot of blood.
Yeah, a lot of blood comes out sometimes.
Girls after quarantine, boys after quarantine. What? Come on.
What are they insinuating at?
Oh, wait a minute. I wasn't even getting the guy. I thought the guy was just jacked in general.
Very poor choice of words.
Not just his one arm.
It is one way to get through isolation, I suppose.
Self-care.
Sure.
My girlfriend's circulatory system is failing.
I get this.
I mean, is that like when you put a hair tie thing on your wrist?
Yes. There's definitely a period of your life where you don't leave home without a hair tie because you just never know what's gonna happen in your day. Also, if you're frustrated, just like take out some frustration.
It's a safe and non-dangerous and non-permanent injury.
Yeah.
When you pee and spread your legs apart too far.
Oh God.
What happens when you spread your legs apart too far?
He's acting it out. You can't see it under the table.
But
he's acting it out. I don't totally get this one. If you've ever been out in the wild where you had to pee in nature, that is so awkward for a chick. I mean, guys have it so easy.
When I asked the doctor why my stomach hurts, it's a hot Cheetos.
I lived on these for a period of time. I'm not joking.
I've never eaten a hot Cheeto ever.
What?
Doing an ultrasound on the abdomen here on the left side, you probably wouldn't see that anyway.
Isn't the stomach like way higher?
The stomach
than
is just,
people?
Yeah, it's like literally underneath the sternum, just kind of sitting right under there. Girls' boobs be like left side, right side. Big and small, 2 different sizes?
Definitely 2 different sizes. There's always one bigger and smaller.
Big one, small one, some as big as your head.
I think left is mine. Is that common?
I don't know if the one side versus the other. It's just like testicles where like one hangs below the other.
Well, I would think because your heart's on the left side, so there's more blood in that area.
It's very good theory. Cramps aren't that bad, question mark. Neither is a punch to the dick. I don't think the male persuasion understands the intensity of the uterus contracting causing menstrual cramps.
I'm sure being punched in the nether region for a dude is painful in its own right. Cramps can be light, and then it can be like, oh, you're grocery shopping, and then man down!
Just drop to the ground.
Yeah.
I think it's time to kick you in the nuts and see which is worse.
For me, just in general, if I work out throughout the month, I tend to have less pain when it's that time of the month.
Is it equivalent to when you have a bad muscle cramp from, say, working out too much and it's really fatigued, and then every time you try to like do something, it like spasms up again?
It can feel like that.
I wonder if it's the same idea, exactly, that it's working so hard and then you're back to normal during the other 3 weeks. Someone with breast implants after their corpse decomposes.
Oh, yeah.
Interesting. I don't think they do studies about this.
They do. And I'm gonna tell you, well, I don't know about studies.
Not in like a casket. I guess they do like studies of people decomposing.
I know a crazy story. There was a guy who killed his girlfriend. The breast implants had a serial number, and they were still intact.
My doctor told me I need to eat more meat. Some butcher was messing around that day.
Oh my gosh.
So I feel uncomfortable only because it looks like balls and a penis. I mean, what kind of meat is it?
I was wondering what kind of meat it was as well. It's like, is that like
Is
shoulder?
it a piece of like filet, like nice tube?
I'm not gonna lie, but sometimes I buy kielbasa sausage.
I mean, it's a good price. It's only 15 bucks. How I feel after I shaved everything, moisturized myself, and washed my hair. Nice.
Nothing feels better than after you shave your legs and everything's all smooth like silk and you're all moisturized. You're like, I better have plans today because tomorrow I'm gonna be prickly as a pear and it is not gonna be cute.
Best feeling in the world.
Amen.
Oh,
hallelujah.
Take it off the block. I mean, that's
slingshot it.
That's funny.
I'm like Houdini. I can get out of that thing with one finger, one hand.
I'm like, baby, need help? Trying to figure this out like it's like a Rubik's Cube. My mental illness acting up at 3 a.m.
It is me, your mental illness.
Yeah, I'm Marge.
Yeah, I was gonna say, this is opposite.
Jen just falls asleep well, but wakes up in the middle of the night and then she's awake.
Who else struggles from anxiety? It's really fun when your brain's like, we're good, we're tired, we're gonna go to bed early tonight, and then it's like 2 a.m.
I wear the Aura ring and it tells me like, you fell asleep in 34 seconds.
Actually, what has helped me lately, just focusing on a meditation mantra.
That way you're not just perseverating on all these things or these tasks that you have to do or worrying about things. You're like, narrow it down.
Yeah.
If she's sick, she needs more vitamin D. I don't know how to take this. Outside, get some sunshine, but
yes, I mean, that's important as well.
that's vitamin D, bro.
I don't think that's what old Willie here is talking about.
I need my vitamin D.
Vitamins are helpful. They're supplements in the sense of like you should be getting it from your diet. And then you want to hydrate well, maybe some chicken soup. Good news, you're not pregnant. Bad news, you're gonna feel like you're giving birth. I have this conversation almost daily with an individual in the sense that people come in, vaginal bleeding, question, pregnancy, not pregnancy, are you having a miscarriage or you're not, do you want to get pregnant and you're not, so many different things. And it's hard to have that conversation.
So you've had to tell people, like they come in for a cough and you're like,
you're pregnant. Depends if I read the room right, I will actually be like, congratulations.
when your mom kisses you boo-boo.
Oh, when your mom
Healing
kisses
noise.
you're a boo-boo.
Yes.
Got it.
I feel like this is not just female oriented. I feel like this is for everybody.
When a parent brings a child to the hospital, the patient, aka the child, is going to lose their mind. Mom kisses the boo-boo, gets better, kid's fine, no problem. Even if it's broken, kid feels much better.
A good hug, that's healing.
Oh, this is nice.
Unless you're really in pain in that moment, but or your significant other.
Like, just care and love and emotion. Doesn't wear a pad, wears pad.
I mean, it's like the rain, right? You bring an umbrella along, surely it's not gonna rain. Similar situation for the female variety.
Dizziness / vaginal bleeding. ER doctors.
Maybe they come in with ambiguous symptoms
Yes.
and you're trying to put the pieces together of what may be the cause.
Usually, if you're vaginal bleeding, you're gonna be lightheaded, might feel a little dizzy, you might feel like you're gonna pass out because you lost some blood, but you're also making red blood cells, and you do this every month. Typically, we'll just let somebody relax, check your numbers, make sure you're okay. Sometimes just giving some oral hydration or even IV fluid, filling up the intravascular space will make somebody feel better. Doctor told me to play outside. Playing outside actually is really good. See the sun, get your vitamin D, helps with circadian rhythm. We're inside, dark rooms, up all night, circadian rhythm and our sleep patterns get all messed up. When you found out that if you die during your surgery, mom will sell your Legos. Okay, I'm not a big fan of Legos because I don't want to step on them. I've never seen a Lego injury come to the emergency department, but obviously you can search it and find that people step on Legos all the time and cause injuries. People do actually die during surgery. Depending on your situation, sometimes you actually do like pre-op labs and things like that to see if you are at high risk for a bad outcome. Yes, you want to know what the risk is so you know going in, but if you don't do the surgery, you're gonna die anyway. Let's see them fix this with medication. Is that an Xbox controller on an X-ray? People are always yelling at me for saying that people don't have nasal bones. You can actually see the very small nasal bone that is there. This is probably a younger individual because of the way the bones look. They look fantastic. So if I eat this apple, will it keep myself away? Oh my gosh. So very funny, I do eat apples. They're very good for you. They're satiating, dense carbohydrates, good for energy, good to actually keep you awake, especially on night shifts that I do, and they're actually good for your teeth. So all those gamers out there, if you need energy and you want to try something different, instead of energy drink, try an apple and let me know what happens. Male, female. Gamer, that is hilarious. Those are the symbols that we use for real shorthand, male versus female. The only way I can remember this stuff is the male, you know what, then the female I know is just opposite that. And the gamer is a USB symbol. Very interesting. Operates with bare hands, goes into battle with gloves. Exactly. The majority of the reason why we actually use gloves is to prevent the physician or the provider from spreading disease processes around. In this situation, unless you have open skin where the blood can get into or open lesions, the doctor's actually probably okay. It's just not sanitary, right? It's gross. You get in blood, it can get in your nails, you can get underneath, and then, you know, there's fecal matter, blood, spit, sputum, all the vomit, and then he's ready to go into battle, got the gloves on. Maybe he needs a better grip on his Medigun. Full health, full ammo, full catheter. Sometimes people come into the emergency department with distended bladders and they have urinary retention. The most common reason for urinary retention is an enlarged prostate in males, and we'll use a Foley catheter. Man, you get a signal to go to the bathroom when your bladder is about 400 milliliters full. We'll see people distended abdomens. I can feel their bladder. I've seen people come in where they empty out like 2 liters of urine into these bags that are down hanging underneath the bed. Oh, awful. All those gamers out there, get up, go to the bathroom. The more the urine sits there, it actually increases the risk of urinary tract infection. So please get it out. Jewish doctors be like, well, money becomes a matter of faith, and that's what I'm here for, to make you believe. This character actually looks really cool. You see, you know, deltoids, biceps, you see a little bit of abdominal muscles, obviously all the ribs and the bones. Please refresh my memory. Tell me in the comments what game this is. As for the meme, I don't really know. Video game addiction is officially considered a mental disorder. Who says? Me. Right in the pinballs. Addiction in itself is a broad diagnosis. You can be addicted to pretty much anything. Now, the WHO, the World Health Organization, really funny meme where you have the symbol of the World Health Organization with the caduceus, which is the snake around the stick, hitting him in the groin. I'm not 100% clear on the meme, but the WHO is hitting you where it hurts. Years of gaming, oh my gosh, it looks like a bicep and it's freaking hilarious. You got the veins going there, so it's so much like trigger pulling. You can actually rupture some connective tissue within the fingers and you can actually get it to where you can't extend. So if you actually rupture this extensor tendon, you can actually end up with a finger this way. What we'll end up doing is put you in a hyperextension splint so it can actually re-heal itself. When the school nurse gives you a band-aid for your broken arm. So you got this whole awesome school nurse ready to go, but gave a band-aid for a broken arm. You need to get that individual to the urgent care or to an emergency department so we can get an x-ray, reset the bones if we need to, put the patient in a splint, get the person to the orthopedic surgeon in the next few days to have it evaluated for possible surgery versus a cast. Acid head bandage, blinding 1,000 people. We see people come to the emergency department with chemical burns to the eyes. Often you need to wash in a wash station for about 5 to 15 minutes. Then we need to do exams to see if the tissue has been burned away. Are you gonna have chronic scarring? Do you need to see an ophthalmologist? Make sure that you actually use safety glasses when you're doing anything that could actually fly up in your eye. That is something that we see very common. After looking around the room for 2 minutes, my wife says, I can't find the case for the wood. What is that? And it's doom. It is not wood. Actually, holding it appropriate, either hold it all the way on the edges, right? Or in the middle. And then, yeah, it needs to be in the case so it doesn't scratch and ruin the game. Game developers, microtransactions, and you. So the gamers develop these beautiful games. Then you can get the game for free. And then, oh no, there's add-ons. You got to pay for this, all these microtransactions. And then it just costs the same amount as getting the game if you bought the whole darn thing to begin with. Vegans realizing they can't beat their meat. Is Mario a vegan? You can choose your diet as you want. Just make sure you're getting the appropriate nutrients. Be healthy, happy, and make sure you have energy by the foods that you're intaking. Me testing, is there fall damage? What game has like the worst fall damage? Like if you actually fall, that takes away so much of your health. Grand Theft Auto, right? If you fall from a great height, you'll be dead in the game and you got to restart. I see people all the time who fall. We get people who have ground level falls, meaning they literally fall from a standing position. That can actually crack your skull open, cause bleeding. Then you see people who fall from first story, third story, fifth story. And obviously the higher you go, the greater the resulting damage. I don't believe that man's ever been to medical school. I do not wear this at work because it gets dirty. Look how nice and white this is. It's beautiful. I work with blood, guts, vomit, poop, and all this other stuff. Like, I don't want that to get stuck on this and have to wash it every single time. If people do wear it in the emergency department, they should wash it every single time. When your wife is into gaming too, stamina, mana, health, drink a potion and feel better. This is awesome. There are different things that you can potentially take to increase stamina, increase your health. You know, people I know, especially gamers, will take supplements to help with focus and energy, and definitely using caffeine. What body type are you? Ectomorph, mesomorph, endomorph, and necromorph. Nice. Necro meaning like death or corpse. I'm an ectomorph, but basically it just has to do a general description of your body type. So no, I don't think there's any necromorphs out there, and hopefully we don't see any in our near future. Testing fall damage. I know the controllers. That's a PlayStation controller, and it is found to be in a rectum. You don't fall on objects and they end up there. They're placed up there with purpose and take actually a little bit of time to coax up there. So if you do actually end up getting a foreign body in your rectum and you can't get it out, please come to the hospital and we'll help get it out. Sometimes you can actually push these out as a normal bowel movement, but the concern is bowel perforation as well as obstruction. Me goes to bed. My nostrils. One's open, one's closed. Interestingly enough, with our nostrils, sometimes it actually has to do with our parasympathetic and sympathetic nervous systems, aka our autonomic nervous system. And also sometimes we have a more dominant side or a nasal cycle where we only typically more often breathe through one nostril over the other. Do you guys have a nostril that's dominant? Let me know in the comments. Doctor explaining a bunch of technical stuff to the nurse. Me, who came for a bellyache. The doctor explaining a bunch of medical jargon. Sometimes patients are like, huh, what the heck is going on? Sometimes we explain things medically because it's quick and fast and a little bit easier. And a patient may ask, hey, can you explain that to me? You know, the easiest thing is just to have a conversation with your healthcare provider in that situation. Post-nut clarity, coming to my senses. I'm guessing the bottom one is more like the release versus the top one is more just like afterwards, like chilling. And again, it has to do with your autonomic nervous system, which is quite normal to have different types of reactions during the process and then thereafter. When your cat jumps on your knee during a horror game. So you're totally into the horror game, you're playing, and then all of a sudden you've got a cat jumping on you, didn't expect it. It's like, oh my gosh, the horror has come to life. Tachycardia, blood pressure going up, sweating. These are all normal reactions to the horror of feeling like the anxiety, which is the normal reaction in those situations. Oh my gosh, 1 year after online classes. Not likely for that to occur because your bone is fused and it's not melting away due to that type of compression. Traumatic injuries to the brain can cause this, where you've had previous surgeries to the brain can cause this. How doctor listen to music? No, we don't do that. But that is quite funny. I'm like, oh, wait a minute. There's a stethoscope. It doesn't work as well as you think, but yes, you can actually hold it up and hear conversations. You can hear music through it. Most people think we just use it to listen to the heart and the lungs. We also listen to the abdominal sound. We can also listen to your neck. Bro, this baby took too much perk. Now he purple. Okay, no. So when people refer to perk, they're talking about Percocet. Percocet is basically Tylenol plus oxycodone. Oxycodone, it's an opiate. We use it for pain control. Again, any type of pain medication treats receptors in the brain relating to the mu receptor. Doesn't actually heal. The HIPAA police, kicking but taking no names. Boom. Kind of funny. HIPAA is basically like compliance laws having to do with like patient identifiers and confidentiality. No names. Pretty good. If you say there's a case that is so rare that just talking about the case is actually the identifier itself. So you have to be careful. We take lots of compliance courses and regulatory things to make sure that we're all up to date. Dr. Salvador, Resident Evil. Okay. I don't believe that man has ever been to medical school. There have been cases in the United States where people pretend to actually be real doctors and actually have medical practices. You can actually look up your doctor to see if they went to medical school. You can also look them up to make sure that they have a board certification. In Toy Story, if I recall, didn't they have the creepy neighbor that tortured toys? Maybe he grew up and he's Dr. Salvador. Shot in the leg, remove bullet from arm. Far Cry. Anytime you get shot anywhere in Far Cry, it always ends up in the arms. If you are shot with a bullet, very hard to get out. There's this whole thing. Me and my wife Jen, we giggle all the time because she notices it in movies now where they always pop the bullet out and the bullet's out and the patient is fine. No, the bullet is like the least of our worries. It's what the bullet actually did to the tissue. Don't feel well. Okay, breathe in. Sharon, send in my next patient. I love that the doc's got the, the make-believe mirror on the forehead that nobody uses anymore, and the stethoscope. We actually try to stay kind of away from patients when we're actually using the stethoscope because most people actually turn and face us and breathe directly in our faces. Jigglypuff, doesn't that character eat a lot of stuff? And that's kind of why the doctor miniaturized and went into his mouth. Do you guys want me to react to a Pokemon situation? Let me know in the comments. A new toothpaste comes out. Doctors?
1 hour later.
Oh, because like 4 out of 5 dentists agree, there's one that doesn't agree here.
That's right, Doc.
Brush your teeth multiple times a day. Good for you. Maybe if you're able to, make sure you brush your teeth after eating. We do get dental emergencies that come to the emergency department. A dentist can't operate or do anything if there's an infection in the mouth because if they start moving around, they can reseed it and get into your bloodstream and you can become septic and get super sick. Video game characters, head wound, bandage on the arm. If you have any type of wound, you need to stop the bleeding. So put pressure on it and then put a bandage on it. Get somebody to see it if it's a big gaping wound. He protect, he attack, but most importantly, he need his hand back. What? Please remind me what game this character is from. If you have your hand accidentally shot off or chopped off, if it's around, grab it, put it in your pocket, take it with you, wrap it up. But then you need to control the bleeding. Direct pressure first. If that doesn't work, then that's when you potentially are going to use a tourniquet. If you have a finger, a limb, something that is lost and you have it, you want to cool it down a little bit. Maybe put that in a bag. Don't do it directly on ice because it can cause frostbite or frost nip. Healing in Resident Evil, the initial ones, and healing in the latest ones. The early on Resident Evil games, you would have like herbs that were like compressed down into a tablet and you can eat them. But now the newer games, you have a water station. There are good herbs out there that do have medical properties to help with certain ailments. You just want to make sure that you're taking it from a reputable place, you're knowing what you're getting, and if you're taking any medications, to make sure that there's no interaction with them. Do you guys take any supplements? Let me know in the comments. Who needs a medical license when you got style? Nowadays, we all kind of wear a cool mask. I actually have not just like the regular surgical mask, the N95 mask, but I've had some other masks that literally look just like that with different filters. But no, my outfits are not like that. I don't wear the white coat, but I do wear scrubs at the hospital, probably either blue or black. Doctor said to play outside. Ba-boom. Get outside, see the sun. Not just for the vitamin D, it also helps with your circadian rhythm. It has to do with like timing of the body relating to like cortisol and different things like that. As well as if you go barefoot and you do something called grounding, good. It has to do with like the electromagnetic pulses of the earth, and you got to be barefoot. So yes, get outside. How PC gamers see equipment. Okay, well, this is a thermometer. They're not as accurate, just so you know. The most accurate temperature gauge is a rectal temperature. I'm assuming this is like a joystick, or using it for a different type of game console. I get the reference. It's funny that any object is looked at as if it was a game console or something that you can use for a game. Playing Fortnite, I guess your heart's kind of chill. Maybe doing some dance moves. I don't even know if that's accurate. And then playing Minecraft hardcore, you're getting a little bit more excited. The heart's moving a little bit. And then doing tasks in electrical. Heart is going nuts. I don't know what electrical is. I know when somebody gets electrocuted, the heart could do this. Basically, you can go into VFib, VTAC, asystole, PEA. PEA is pulseless electrical activity, where you're getting electrical activity on the monitor, but the heart's not beating. Can't feel a pulse. We'll throw an ultrasound on somebody's heart and see if it's actually moving. Really cool. We have the ability to do the ultrasound on demand in any of these situations, put it on somebody's chest wall, and be able to see if the heart is beating. When Lifeline drops a health drone, okay, it's attached to a weird spot. Is it attached to the groin? That is kind of weird and totally inappropriate. But is it attached to the belly button? We were in the womb, all of us, and we were attached by our belly button to the placenta to get nutrients. In the emergency department, we actually sometimes see newborns that still have the umbilical cord piece still there with the clamp, and parents get a little worried. Is it okay? Does it look okay? Does it look infected? But, normally it's going to like dry out, kind of shrivel up and fall off, which is totally fine. Facebook is more detrimental to your mental health than video games. Your 40-year-old Facebook moms. I think I get it. Why would any platform be potentially detrimental to your health? A couple different reasons, right? One, screen time. Shouldn't be on the monitors and watching your phones. There's a specific eye strain that we know about. And then again, you're inside most of the time. You need to get outside. You need to move. You need to get your body moving. Then the other component is social media. It's like you're seeing things that may not actually be true, that are staged, and different potential misinformation or disinformation. So you just have to be aware. It causes undue stress on individuals. People will say when they take a break from social media, they feel much better. Me, what was your favorite class in school? Gamers, health. Me, why? Gamers. Gotta get that extra health after I got shot in the head. Okay. Yes, I really do like in games where they incorporate the ability to heal yourself, the ability to use different medications. There's a lot of different games that I've reacted to that have a lot of health components to it. So definitely check that out. If you get shot in the head, I don't think this health bag's gonna necessarily help. We see people that get shot in the head and, brain matter's missing. The likelihood of survival is pretty low. People do survive, but not necessarily to live a life that was the same one as it was before. A lot of times we see people who get shot in the head and they might be brain dead, but they become organ donors for other individuals. We live in a video game, MFS, when I push them off a cliff to check if they have a health bar. I'm so out of it. If you push somebody off a cliff or you fall off a cliff, this is going to be probably a big fall, because if it's a cliff, you're referencing something that's quite high. So the likelihood of survival of something that's that high is probably unlikely. Depends on what you're falling on. It depends if you have a parachute. But, you know, we see people that come to the emergency department with falls maybe of anywhere from 10 to 30 feet, and it's a major trauma. You have to be really careful. And we're going to do a head-to-toe survey. We're going to do our ABCDE and make sure you're okay. Breathing and breathing. Okay. EA Sports, get in the game. Breathing apparatus machine. This could be a CPAP or a BiPAP. It's most likely a CPAP, which is a continuous breathing apparatus that people use at home, typically for sleep apnea. When people come to the emergency department and they're in respiratory distress by the EMS system, but you don't need to be intubated, they'll put you on CPAP, okay, continuous. But most of the time we will switch you over to BiPAP, meaning it's two different phases. There's different types of pressures going in with inspiration versus expiration. Bone joint gets dislocated. Normal people get treatment from medical professional, aka me. Gamers, snap it back into place, right? It's like snap, put back together. It looks like maybe a wrist dislocation or a finger, hard to tell from this view, but sometimes people will dislocate something and then pop it right back in. I will say getting a dislocated joint back into anatomical position as soon as possible will have a better outcome, because you have now reduced the risk of it being out, the stress on the joint itself, the muscle tension, the swelling, and then it actually prevents more long-term damage of like arthritis. But we see this a lot, and we have to make sure that when somebody dislocated a joint that they actually didn't also fracture something, because I've been in a situation where somebody has a fracture dislocation and part of the broken bone is in the joint itself, which is then preventing you from having the ability to put the bone back in because there's something in the way. Nobody, a 6-year-old me, after putting on a toy stethoscope. Let's go practice medicine, okay? I mean, there's always the toy stethoscopes out there, and everybody wants to be, you know, a doctor in that situation. And actually, some of those stethoscopes do work. So what is a stethoscope, okay? It's a device with a small diaphragm on it that allows us to hear different sounds that are going on the inside. Literally, you can also hear sounds. You see people are trying to rob banks, and they put stethoscopes on the thing so you can hear clicks. Yes, it makes the sound louder, and this way you don't have to be so close and put your ear on somebody's chest, but you can literally put your ear on somebody's chest and hear what's going on the inside. Do I wear one? Yes, I actually use one at work to listen to lung sounds and listen to heart sounds and sometimes to abdominal noises. Nobody, my stomach during an exam, screaming. This individual is quite intense at the moment, screaming at the game. Maybe during an exam your stomach is growling versus in a lot of pain. I know when I do an exam on somebody's abdomen, I'm pushing in all 4 quadrants: right upper, right lower, left lower, different organs in different areas. I'm nice, I won't push very hard. I will go to the spot that is hurting you the most last, that way you know what's happening. And no matter what, when you push on somebody's abdomen, it is uncomfortable, but I'm trying to elicit and reproduce discomfort. And why is so then I can figure out what organs underneath might be causing an issue. You know, right upper quadrant, your gallbladder, your liver, part of your stomach, part of your pancreas, could be your intestines as well. Then, you know, right lower quadrant, that's where your appendix is, that's where ovaries are, that's where your colon is. Things to think about. Babe, doctor's orders. Try anal. It's probably pronounced Trianol. This medication is like the exact same medication as Furanol, which we use as like a headache medication for pain. Don't believe your significant other when they say this is the doctor's orders. This is really funny though. When you don't know what one of the vital organs are, what the hell is the big blobby thing? It's a cool image. You can see the cerebellum in the back and you see the cerebral cortex. Most docs, we don't know how to read MRIs actually, and that's why it's left to the radiologist. Vital organs, what are they? Your heart, your lungs, your brain, your kidneys, your liver. Young child, Play-Doh, is this food? Yes! Oh my gosh. I believe it's labeled as non-toxic. A lot of times in the emergency department, we don't get kids coming in too often with just randomly swallowing things or putting them in their mouth. But usually it's ears and nose where we actually see things get lodged in that we have to, you know, figure out how to get out of there. You can't have a mental illness if the psychiatrist doesn't accept your insurance. Oh my gosh. A lot of hospitals, as well as doctors that have offices, they will take patients without insurance, but they will come up with a financial plan to figure it out. If you're billing an insurance company, the insurance company doesn't pay that bill the way that it actually is written, versus if you send that bill to an individual, without the understanding that it's an individual that's paying it, then yeah, it can be astronomically high. If you have a conversation with either the billing department, the billing company, there are options that they can do for you. ADHD is a superpower. ADHD is a attention deficit / hyperactivity disorder that is the most common neurodevelopmental disorder of childhood. And it has to do with trouble paying attention, impulse behavior issues. Some people can't focus, and so they get medication they can focus. The deceased patient passed away while masturbating. He died having a stroke. Oh my gosh. Little play on words, okay, I get it. Not cool. Could you have a stroke if you were masturbating and then die? Yeah, you could. If your blood pressure goes up, increasing weird blood flow to the brain, and too much physical exertion. I see more common in the emergency department where people either stroke or have a heart attack during sexual intercourse, where it's more of a full body activity actually. My left eye, my right eye. What happens all the time? I will ask you a million questions if somebody comes in with eye problems related to, do you have two images? Do you have double vision? Do you have blurry vision? There could be an infection over the eye. Sometimes this also could be like a cataract where the cornea is hazy and it needs to be removed. If you start having blurriness or any visual changes to your eye, get to the hospital immediately. Could be a stroke, could be a brain bleed, could be a tumor. I'm having 99.3 kids. Oh my God. It's a thermometer, not a pregnancy test. You're not having 99.3 children. Our bodies are 98.6 degrees Fahrenheit. It does change by activity, it changes by actual sex as well. Typically, women are a little bit cooler. Before I go into the next meme, make sure you subscribe. When my grandpa with Alzheimer's forgets he's dead. Alzheimer's is a type of dementia. You don't recognize the people in your life around you. Sometimes you're worried that they're going to hurt you, and these are the people that care about you. And unfortunately, the brain almost resorts back to being very childlike. People in 1971, I bet that in 50 years, there will be flying cars. I'm still waiting for the flying cars. People now eat glitter pills to make their poop sparkle. Oh my gosh. Stupid invention. Why put something in your body that has no benefit whatsoever? People come to the emergency department all the time with poop related problems, and I ask them, what does it look like? And they always just say, I don't know. I didn't look at my poop.
I don't know.
How am I supposed to help you if you don't look at your poop? And now, me, the nice guy over here, has to potentially do a rectal exam. I don't want to do that if I don't have to. Take a photo of the poop. Let me know. Doctor's whole career, apples. Oh, that's kind of funny. It takes so long to become a doctor, all the schooling, education, continuing medical education, and then apples, right? Apple a day keeps the doctor away. Apples do have their benefit. They're healthy for you. They help your teeth. They help you stay awake. Continue to eat your apples, please. You can't fix stupid, but you can sedate it. We do sedate people in the emergency department for, say we need to intubate you. We want you sedated. There are other times we will sedate an individual when they are a danger to themselves or other people. There are effects that drugs may have on somebody that are unknown until that medication is in that system. We have arsenals at the hospital of different medications, pharmacists, and all the staff there to help prevent any negative outcome. Nobody. Doctors turning a page. When we used to have newspapers and stuff, people would like lick their fingers so they can get the paper to then turn the page. I'm not sticking any of my fingers in my mouth while I'm working, even though I wash my hands in and coming out of a room every single time and put on gloves. The previous doctors, the doctor, get ready everybody. He's about to do something stupid. Maybe this doctor's trying to do something different compared to the previous doctors that might have tried everything already and everybody's just watching. They're only watching because one, they want to see if what they're actually doing is going to probably work, or is it going to be a disaster? If it is a disaster, you have all this other support staff there. ER doctors, see the patient, history, physical exam, CT scan. I think all of that is important. 90% of understanding what we need to do is based on the story and the history. I will also say, if we do the physical exam, the history, and we come up with a diagnosis, you know how many people ask, why are you not doing a CT scan? If this is something you want, understanding the expense, radiation exposure risk, we will have a discussion and talk about it and likely do it. Looking at myself in the mirror after taking off the face mask. It happens. For a little while when the pandemic of COVID first hit, I was always having like massive red marks to my nose. People were getting rashes on their face. They were having a lot of dermatitis, inflammation of their skin. But you're in an area where there's a lot of germs. There's a lot of disease. Why wouldn't we wear a mask? Delete my browser history. So this is like a medical alert bracelet that typically you put allergies on. Sometimes you can have like medical diagnoses on here as well, which would be helpful, or a phone number. If there's something you don't want people to know or see, don't look it up. Does anybody out there use a medical alert bracelet? Let me know in the comments. BMI equals bad medical information. Oh my gosh. BMI stands for body mass index, which is a really crude way to basically measure if you're like obese or not. It has to do with basically height and weight. We don't use it so literally. We use it just as a measure. My foreskin to the American doctor. You didn't have to cut me off. So that's like a song. Oh my gosh. And this is the singer. Foreskin is the skin of the penis that's covering the head of the penis, the glands, penis. A lot of times it is cut off for multiple different reasons. Cleanliness factor, religious reasons. A lot of times in the United States, cut it off when the kid's still in the hospital as a newborn, versus you can do it at any time in somebody's life. Doctors. Does it hurt when I do this? You're trying to say that we as doctors are a little brutal when we do procedures? You know, for me, I can only speak for myself. There are procedures that we do that are uncomfortable and painful. We're using needles, we're using sharp objects. It's going to hurt. So I actually am quite honest and actually probably lean more towards the side of telling somebody this is going to hurt, but it's only going to hurt for a short period of time. I think the worst discomfort is, say, the injection of the anesthesia, which is like lidocaine, because it actually causes a lot of pain. It has to do with the temperature. Lacking vitamin U. Oh, like you're missing somebody or another person. I was thinking like play on like uremia or uric acid. You do have to be careful. If you're not getting a balanced diet in general, you could be missing some important vitamins. So please make sure that you have a balanced diet. And sometimes you can actually ask your doctor to do a type of vitamin panel. The most important one we really check for is a vitamin D, just because you have to worry about some vitamins, A, D, E, and K. Bro looks like he's covered in peanut butter. Doesn't look like peanut butter. It just looks like the fat percentage of this body is probably so low that you're seeing all these vessels that are just underneath the skin. Maybe the peanut butter due to the color? I don't know. Bodybuilders have like a significant amount of veins, or they're very large because of demand that they're requiring to get oxygen and blood to the tissue by what they're doing by building muscles and heavy lifting, but also because they have a reduced amount of body fat as well. So that combination, they start to be more prominent. Healthy lungs, lungs of a vegan. So we got asparagus and some citrus fruit versus the normal appearing lungs on the left side. But they're not actually that normal in appearing, right? The right side should have 3 lobes and the left side would have 2 lobes plus the lingula. So they're a little off. They're very much a mirror image of each other. So yes. Successfully becomes a doctor after cheating in online school. Patients in 2040. Yeah, no bueno. I don't think you can actually take all your courses for medical school online. Thus, there's really not much cheating. It depends what you mean by it, but if you have the answers, no, that's cheating. But trying to write notes and things like that, not necessarily cheating per se. But this meme is quite interesting in the sense of like, if you're cheating now, you're cheating yourself and your patients later, right? Embarrassed? Don't worry, I'll just pump more blood to your cheeks. So typically when somebody is embarrassed, usually somebody would actually get flushed, meaning more blood to your cheeks and to your skin. But very good picture of the heart. You got the coronary vessels on the outside and the appropriate ventricles, and you see all the other tubing and structures thereafter. Very cool looking. Human anatomy is amazing. Label me like one of your French girls. Huh? It looks like it's got the lines to label structures of the anatomy of this skeleton. I am not sure what this is referencing, but the skeleton is in a very seductive position. The label me part, that's more up my alley because I know what that means. You have structures that you need to label skeleton wise. Yes, in medical school, we would have to know every single thing in the human body. The doctor with my balls. I'm assuming we're pushing too hard, but we're not trying to push too hard. Yes, we don't know the discomfort per se, but we're trying to feel for masses or inflammation or types of infections by doing a palpable exam of the testicles. But it is really, really important that you do self-exams almost every day of your life, at least when you're in the shower, because you want to make sure that you don't feel any abnormal lumps that weren't there. The easiest way to get rid of cancer is to get early detection or have early detection so then it can be treated immediately versus waiting. Doctors have gone on strike, but their demands are unclear. Do you know how many things I have to sign by any legal measure? As long as you can identify that it is actually your handwriting, then it's fine. But when it comes to instructions, it needs to be legible so people can understand what you have written out. Luckily now we have a lot of EMR, electronic medical records, so most of the things that we jot down and write for people is actually just from the computer, so you can actually read it quite easily. Doctors be like, this is a dangerous place. An apple a day keeps a doctor away. Apples are really good for you. They're good for your teeth. They're good for your health. They're good for your digestion. Definitely take an apple over a candy bar. At the doctor's office, Mom, please don't touch anything. Toddler, licking everything. It is so true. Touching everything, surfaces, licking. Oh my gosh, we do our best to not have them do that. The hospital is clean, but maybe a person just came right in there and vomited or peed on the floor. We're using pretty good industrial cleaners. We're using UV lights, a lot of things to kill everything, but still gross enough. So please don't lick, touch anything. Make sure you wash your hands. There's plenty of those hand sanitizers everywhere, as well as sinks with soap. Me. What can I do to get healthier, doctor? Doctor, use a bicycle and cut the carbs. Oh my gosh. I'm a New Yorker. We love pizza, but you do have to be careful. Excess amount of just pizza in itself. You got tomato sauce, you got cheese, you got fats, but just make sure you're not eating too much. And yes, exercise has been proven to make you healthy. Losing weight is not just exercising. It's more related to calories in, calories out, what you're actually eating. But exercise, keeping your heart going, and it's actually been proven to increase longevity. When I call it a hematoma instead of a bruise. Oh, got my glasses on. Hematoma, contusion, and ecchymosis. All terms that we use to kind of describe a bruise. Hematoma is typically a big collection of blood under the tissue, and usually it's a lump. Versus ecchymosis, it's more of a bruise. Contusion is typically underneath the skin, kind of lumpy bruise as well. So they all kind of mean the same thing, but an ecchymosis is actually more synonymous with a bruise. Not sure if patient is severely delusional or the most interesting man in the world. Sometimes when we describe delusional, we're meaning somebody who is having maybe really bad exacerbation of schizophrenia versus is there psychosis going on from a medical condition. There's a lot of different things, but sometimes you're having conversations with these people and they're quite intellectual. They have good ideas, but they might just be down one road or the other that just doesn't seem right. When you're trying to convince your dementia patient that there are no meds in their food. Looking at the med just off the top of my head, I see a 10-325. That is an opiate, okay? The 325 is the Tylenol or the acetaminophen, and the 10 could be oxycodone or hydromorphone. And then you see the one that's yellow with the pieces, that's actually like a street drug that we call a Xanibar. Super easy to use a pill identifier and just Google it or look it up and they'll tell you what exactly the medication is, but you wouldn't be giving these medications to demented patients. Waking the patient up to give meds at 4 a.m. in the morning, be like, ah. Are we waking the patient up and screaming at them, or does the patient wake up freaking out and scream? All I know is when I go to wake up a patient when they're passed out and sleeping at the hospital, it's a gentle shake, usually to the foot. If it's not working, then the shoulder, and then you start to get loud to try to wake them up. And usually the patients are quite disoriented because you're not sleeping in your normal place that you would normally sleep, so you have to give people a second. Did you hear that ICU bed 5 has maggots in an open wound? Me? Normal people. This is a thing. Maggots occur in wounds. The big question everybody always asks is, did the maggots grow there or did they like flock to the tissue? Hard to know sometimes, but maggots are actually good for dead tissue because they're actually cleaning the wound and cleaning and eating the dead tissue. Now, I've seen many patients with maggots in different wounds in my life, and some there's a few, some there's hundreds. My reaction to it is always the same, and same with all staff. Every staff member does look like the me version of like, I want to see, I can't believe it, versus normal people are just like disgusted and baffled. Me, it's just a cough. My parents, it's just a cough. The doctor, it's just a cough. Google. Yeah, you're dead. So anytime you look something up on the internet, it's gonna give you the worst case scenario. I guarantee you it's always gonna say cancer. But most of the time it is just common cough, cold, something simple if that's the case. But obviously if you're concerned, talk to your doctor, get it done. When a patient doesn't want to cooperate with any of the medication or treatment, okay, get in. Oh my gosh. This is so common. So many patients come into the emergency department.
We need a medic here, stat!
Blood pressure's through the roof or something like that. And you say, hey, do you have a history of blood pressure? Yes. Do you take your blood pressure medicine? No. We're trying to help you. Please take the medications that we prescribe. You have 10 hours to live. Me? Biggest boy. So maybe Chris always wanted to be in this type of pageants or body. So YOLO. Doctor, you're pregnant. Congratulate me. There are many times that somebody's there for like nausea, vomiting, or abdominal discomfort, and we check pregnancy tests and we have to tell them that they're pregnant. Sometimes there's shock, sometimes there's anger, sometimes there's nothing, and other times there's like crying and happiness. But there are options out there. First off, if you don't want a baby, use protection in any which way possible. Barrier protection, medication protection, abstinence. I totally get this. I just hope that nobody's actually doing this. Doctor heals a dying person. That person's family, thank God he's alive. The doctor that healed him, it happens all the time. The family's so excited, they kind of forget to give credit to the staff and the hospital and the doctor. But we're there to do our job, we love it, and as long as it's a good, positive outcome, it doesn't matter. Time for a diagnosis. I lost another one.
Another one.
Oh my God. For me, in the emergency department, I actually don't need a diagnosis. We just need to put down symptoms. If we don't have a diagnosis, we can put shortness of breath. We can put chest pain. When you write 16 respirations, but don't actually count them, Christ is watching. This is basically saying like, maybe you're just making that up and you're not actually counting. It's actually quite funny for me if you ever see an odd number, because that's kind of weird. Anesthesia invented 1846, doctors in 1845. Nice. We can use an anesthetic to numb up an area, or we can use anesthesia to basically knock you out so you become unresponsive, but we're controlling your airway. And we have different degrees. In the emergency department, we'll actually do moderate sedation using different types of anesthetics, but we can still keep you breathing on your own and make you aware of what's going on, but you're not really hearing. So it's a huge spectrum. When they ask you to show the new nurse around, this is where I come to cry. Cool. Oh man. Even myself, I'll get frustrated in a case or something like that, or if somebody dies, I might need my time to go somewhere off on my own because one, you don't want to show the emotion and you have a job to do, right? Go deal with whatever emotion it is you need to deal with and then come back and hit the ground running. Doctor, saves your life, credit card declines. Doctor, free trial of living has ended. Oh my gosh. No. I never know if somebody has money or not. I never know if somebody has insurance till like later down the road. We treat everybody the exact same. This is not a free trial situation. Why did you take your antibiotic at 6 a.m. when I told you 9 a.m.? Me? I wanted to surprise the bacteria. Some medications are Q 6 hours, Q 12 hours, Q meaning every, and sometimes they're TID, BID, QID, meaning like BID is twice a day, TID is 3 times a day, QID is 4 times a day. The reason for that has to do with the half-life of the medication and the metabolism of the medication. So if you're taking it too soon, the medicine hasn't finished what it was doing, so you're taking almost a little bit extra in that moment, versus if you wait too late, there's a period of time where you don't have the medication in your system. Sometimes people forget, and that's fine. You can always set a timer on your phone. Doctors, don't worry, the x-ray is completely safe. Also doctors, locked behind the door. One x-ray is equivalent to one plane ride. So you're getting a little bit of radiation exposure, but not a lot. Versus like a CAT scan's like thousands of x-rays. But think about this. I see 20 patients a shift. Each patient may have an x-ray or not. If I'm standing right there, I'm getting exposure to 20 x-rays versus that patient's only getting exposed to one. Good news, you don't have herpes. Get well soon. Oh my gosh. It's good news when you find out you don't have herpes because it's a virus and it can lay dormant in your body forever. Nothing to worry about, just keep soaking it. Oh my gosh. The only thing I tell people to soak when they go home is an abscess or infection that's going to be an abscess. Use warm compress, maybe warm water to draw it out. Or if you have like bad hemorrhoid or an anal fissure, after you go to the bathroom and have a bowel movement, you sit in a sitz bath and soak your butt to clean it out. Most of the time, if a doctor's telling you just keep soaking it, do they really know what they're doing? An apple a day? Doctor. Oh, I get it. Not just an apple, but good diet, balanced, eating the rainbow of veggies and fruits and protein, which then will keep you healthy and keep diseases and medical problems from hurting you. And it could keep you regular. When your shift was over 30 minutes ago and you are at the ER like, bye. So if my shift ends at 5 o'clock and somebody rolls in at 4:45 with a heart attack, I can't let that patient just wait for the next doc. I have to see that patient and I'm not leaving at 5 o'clock. Doctor, lose your weight to be healthy. Also, the doctor, oh damn. If I heard from an overweight or obese physician telling me to lose weight, it's not gonna really hold that much weight. So that is why I'm in shape, keeping that six pack. Don't just say, hey, you need to lose weight. Help, give suggestions, ideas, books, things that you can do to guide somebody. It's over, Stan. COVID is here. Soon, only 99.98% of us will remain. Oh man, survival rate of COVID, 99%. But think about that when it comes to billions of people. That small percentage is actually a lot of people. Millions of people have died of COVID. Throw this meme out, I don't like it. Doctors be like, go buy this. So I bought a snake. That's so funny. Thank goodness everything's electronic. The only thing I ever have to write with my penmanship is actually my signature. My signature's pretty horrible, but because we have to sign things so often. Oh my gosh. When you walk into a patient's room and see a million family members. Yes, that's actually very accurate. I can only speak for myself. I got good game face, and I learned that a long time ago because I went into a room once when I was a medical student and the patient was like, are you okay? I guess I had it like written all over my face that it was like shocking. But now, walk into a room, no problem. Pretty confident guy here and know what I'm doing, know what I'm talking about. These were funny. If you guys have any memes that you want me to check out or you think really funny that I might get a kick out of, please send them my way. And as always, check out this playlist right here. Make sure you subscribe, turn those bell notifications on, hit that like button for me, please. Thank you so much for watching and stay healthy, my friends.